Will a prostate ultrasound requiring any special preparation? If you are scheduled for a prostate ultrasound, you might be wondering about any special preparations needed to ensure the best results. The preparation can vary depending on whether you are having a transrectal or transabdominal ultrasound, but there are some common steps to keep in mind. For a transabdominal ultrasound, you will typically need to drink about 1 liter of water, which is about 32 ounces, about 1 hour before the exam. It is important to avoid urinating until after the procedure. A full bladder helps create clearer images of the prostate through the abdominal wall. So, make sure to follow this guideline to get the most accurate results. If you are having a transrectal ultrasound, which involves inserting a probe into the rectum, bowel preparation is often recommended. This may include taking a small enema tutu for hours before the exam. This step is crucial as it helps clear the rectum for better imaging and can also reduce discomfort during the procedure. This preparation is especially important if a biopsy is planned during the ultrasound. You should also pay attention to your medications. If your ultrasound is part of a biopsy procedure, your healthcare provider may advise you to stop taking blood-thinning medications, such as aspirin or other anticoagulants, about 7 to 10 days before the exam. This is to minimize any risk of bleeding. Always consult your healthcare provider for specific instructions based on your medical history. When it comes to clothing, it is best to wear loose and comfortable attire. You may be asked to change into a gown for the procedure, so keep that in mind. Additionally, it is a good idea to leave jewelry and other accessories at home or remove them before your appointment. Before the procedure, your healthcare provider will explain what to expect and may ask you to sign a consent form. This is also a great time to ask any questions or express any concerns you may have about the ultrasound. Lastly, some clinics may have specific policies, such as being scent-free environments due to staff allergies. It is wise to follow any additional instructions provided by your healthcare provider or the imaging center. In summary, preparing for a prostate ultrasound typically involves drinking water to fill your bladder for transabdominal scans, possibly using an enema for transrectal scans, adjusting medications if a biopsy is planned, and wearing suitable clothing. Following these guidelines helps ensure that the procedure is effective, safe, and as comfortable as possible. Always remember to follow the specific advice given by your healthcare provider, as individual recommendations may vary.